Today we're diving into adult female acne, something I see every day in clinic. As always, this is informational only and not to be used as medical advice. Enjoy. We are going to talk about adult female acne. This is something I see every single day in my clinic as a dermatologist, and I get a lot of questions about it. So I thought making a video would be helpful for those curious and wondering why, as an adult female, do I now have acne, even when perhaps I didn't as an adolescent or child. So here's a little overview. It impacts so many people. Here I have 12 to 50% of adult women can have adult acne. It is increasing in prevalence, and we can dive into exactly why that is. And it's horrible. It causes significant emotional distress. You wake up every morning wondering, what am I doing? What am I eating? What am I exposed to? Is it something I'm putting on my face? Is it the makeup I'm using? Which then, of course, makes you more stressed. And of course, we know stress is bad for your skin. So then there's this cycle that is really hard to break. So, common skin condition, particularly in females over the age of 25. There is the persistent acne, which is people that maybe had it in adolescence and then it kind of extends into your early adulthood, late onset acne, and then recurrent acne, which was in the adolescence, improved, and then returns. So adult female acne can be very mild, but it can also be quite severe. We have some patients that are quite severe, and it can lead to scarring, which of course is something we're trying to avoid in all cases of acne. So let's talk about the causes of adult female acne. So we have fluctuating hormone levels, and we can see that because acne can fluctuate with pregnancy, with menstruation most commonly, and even menopause. We talked about jawline acne being a sign of hormonal imbalance. Changes in sebum composition. So as we age and as our hormones change, we can have alterations in our sebum and in the lipid content in our skin, which can impact acne, obviously, inflammation otherwise. And then underlying medical conditions, things like PCOS, which I kind of think of as a metabolic syndrome and can contribute significantly to acne with fluctuations in hormones as well. External and lifestyle factors are something I try to talk to every patient about. Of course, there's a genetic component. Mom and dad had acne, pretty severe. Now I have acne. But more and more, I think it's things that we're putting on our face, things that we're exposed to, internal stimuli and triggers like stress. So, skincare routine, very simple. I'm not even going to discuss it here, but you can read this. There are some very simple steps that can improve anybody's acne, regardless of why it's happening. Stress management. I try to talk to every patient about this, but stress makes everything in our skin worse. We had cases when I was studying at the university where patients would have significant stress from a lost job or a sick child, and they would break out into whole body rashes, which we couldn't really decipher or treat successfully, even with many thousands of dollars of tests and studies. But ultimately, when the stress subsided, the rash got better. So stress is horribly important. We know, stress and sleep are related. So of course, sleep is important for your skin, hygiene and habits. So things that, reduce bacterial load on the face, like touching your face, your phone, workout gear. We know those can trigger acne. Sunscreen is important, not necessarily because it prevents acne, although some people think, sunlight, prolonged sunlight can dehydrate the skin, can make the skin a little bit more prone to acne, but it also helps reduce the sequelae of acne like inflammation and redness and scarring. And then dietary modifications. If you asked a dermatologist 15, 20 years ago, they would say there's no real good studies to show that what you eat impacts your acne because dietary studies are very hard to do. But now we do have some good studies. We have studies that show that increased glycemic index, which means foods with just more sugar, processed foods, can trigger acne. We know that a certain type of milk, dairy, particularly skim milk, can stimulate hormone production and sebum production and stimulate acne as well. Omega 3s. The research is okay for omega 3s. It's not particularly strong, but some patients find that the omega 3 intake can improve acne. We know that omega 3s are anti-inflammatory. We know they're good for so many different things. So why not acne? Something easy and safe to do for most people. Anti-inflammatory herbs and spices, good for everything. The literature behind them with acne is limited, but I wanted to include this just because I think everyone can benefit from a little bit of extra cinnamon, turmeric, among other things. And then some patients, I even have them consider a food diary because everyone thinks, their diet is okay. I had one patient who says, I only eat one meal a day. And we discussed what those meals were. And for example, I said, what did you eat yesterday? And she said, all I had was Chick-fil-A, but I just had one meal. So even though all you had was Chick-fil-A, not necessarily the best thing for your skin or your health. So when someone comes in with their acne, we treat them various ways. I won't dive into this now. I'll have another video regarding treatments, but various treatments that are safe and effective when used correctly. There are alternative therapies nowadays, some of which are very very elegant and easy to take and use. We have supplements. Again, the literature behind supplement use is okay. I implore you to come to the website and look at the links here because you can see the studies behind each one of these supplements. For a lot of patients, I recommend omega 3s. I recommend vitamin D. You can even check vitamin D levels to assess where you're at. Probiotics, which I have a whole nother video on regarding the use of probiotics for acne. Vitamin B3, whether it's topical or orally supplemented. And then green tea extract. Green tea, actually, you can drink it, but you can actually steep the green tea, you can soak it, and you can actually apply it onto your face, which has antioxidant benefits as well. So here's a little table. You can come to the website and look at it. There are some recommended doses, although you should talk to your healthcare provider before that. Sometimes acne is just so frustrating that you need a multimodal approach, whether it's topical and oral therapies from a dermatologist and some lifestyle changes here to get it under control. If you found it helpful, please share this with friends. This all helps me reach out to more people and share this with people that might find this interesting or helpful in their own lives. If you have any questions, concerns, or if you want to talk about something in particular, please let me know, drop it in the comments, and I'll do my best to get back to everybody.